Hello, my name is Muza Moons, and I'm an IBD specialist at the University of Michigan. Welcome to the IBD School 200 series. In this video, we will be talking about C. difficile infection and reinfection, as well as testing and retesting. C. difficile, also known as C. diff, is the most common infection we worry about because it triggers flares and is very common in patients with Crohn's disease and ulcerative colitis. In studies, IBD patients are 4 times more likely to have a C. diff infection than other hospitalized patients. This infection is associated with increased disease severity and poorer quality of life. Patients can get this infection either from taking an antibiotic that allows overgrowth of the pathogen, being in contact with healthcare facilities where the bacteria is more prevalent, or 40% of IBD patients have infections from an unknown source in the community. Early testing for this infection so that early treatment can be started is critical for improving outcomes and preventing the need for colon resection or surgical removal of the colon. There are several C. diff tests, and all of them are performed on stool. Some hospitals perform the Glutamate Dehydrogenase test, which looks for bacteria, while others look at the EIA Elisa assay to look for toxin production. Coupled together, these tests identify the presence of C. diff bacteria in most cases. However, specific testing with PCR for the toxin gene is most sensitive for detecting active C. diff infection. Detecting and treating C. difficile early in an acute flare is critical for improving patient outcomes. We will address specific ways to treat the infection in the next video, Series 203. If a patient responds to therapy with improvement in diarrhea on therapy, we do not recommend rechecking for C. diff infection or checking for cure. However, about 30% of patients will have a recurrence of infection shortly after stopping their antibiotic treatment or up to 3 months later. If the patient is having clinical symptoms of C. diff infection, retesting is indicated. It is very clear that patients with inflammatory bowel disease have a high risk of C. diff infection and increased risk of repeat infections. The recurrence rate for C. diff amongst IBD patients is as high as 40%, and that means that patients initially improve with treatment, but then have worsening symptoms. Unfortunately, when C. diff comes back, it is more difficult to treat, and we can discuss treatment strategies in the next video. Overall, I like to stress the importance of treating both the infection and the active IBD to achieve the best results for my patients. I'm Muza Moons, and thank you for watching IBD School.